early this morning, thousands of Floridians woke up to news that their appointments to get treatment for COVID-19 infection were canceled by the Biden administration, which outright revoked authorization for two very popular monoclonal antibody treatments that the state of Florida really pioneered over the summer and that we've worked hard to make available to our residents who needed treatment. Mind you, the people that seek this treatment are overwhelmingly people that have been vaccinated, but yet they're still infected, and many of them are high risk. Now, they are relying on revoking this and pulling the rug out from under people on a single, non-peer-reviewed, non-clinical study that was actually done by a consultant for a rival company to the other two monoclonal antibody treatments. This is not based on a clinical trial. This is not even peer-reviewed. And so this is something that they claim shouldn't be used because we have Omicron. And what we would say in Florida is we have had people use it and we've had good results. It's not 100%. We understand that. But you also don't even know when someone goes in whether it's Omicron or still the Delta. Yes, mostly in Florida it's going to be Omicron at this point. But it's really a reckless decision to be able to take this option away from patients when we've had the site set up, we've had this distributed to different medical groups or hospitals. And if somebody wants to try, it was very effective against the Delta. If you look at once that program went in, you saw a huge decline in hospitalizations, and we were proud to be able to fill really a void which shouldn't have existed if you had people, the higher ups, were actually promoting early treatment, which they weren't. So we're proud of that. But even if with Omicron it's half as effective, or even 25% as effective, that's better than nothing for people. And as I've said, anecdotally, we've had people that have had their symptoms resolved after doing it just in the last month of doing this. So this is wrong what they're doing. And we have many people now who are very concerned because they were going to go in and get it today or tomorrow, and now they're being told that it would be illegal for a provider to give it to them, all based off one observational, non-peer-reviewed study. And this is done, I think, in a very haphazard fashion. And you have so many problems with this administration. You look at inflation spiraling out of control, and yet they're doing things to fuel it. You look at the southern border, which has been a total disaster and continues to be to this day. You look what's happening in the gathering storm abroad, whether it's Russia, China, America's adversaries. You have huge, huge problems going on. You have ineffective COVID restrictions and mandates that are being championed in other states that are inhibiting our supply chain and contributing to economic problems. So you have all these issues that could be addressed. And so what do they choose to do with their time? They choose to pull the rug out of elderly patients, most of whom, almost all of them, have been vaccinated, and say you don't have access to this treatment. So we're going to fight back against this because this is just wrong. This is not the way, that you help people. And our view is people have a right to access these treatments, and to revoke it on this basis is just fundamentally wrong, and we're going to fight back.